You know, after 30 years of delivering babies and holding mothers through their darkest hours, I have learned that silence is sometimes louder than screaming. A woman who cries, who shouts, who begs for answers, she is still fighting. But a woman who sits completely still, with empty eyes and dry lips, that is when I truly worry. That silence means she has already started to bury her child in her heart. I remember a case that still visits me on quiet nights. A young woman walked into my clinic on a Tuesday morning. Her name was Mira, and she was 22 weeks pregnant. She was holding a folder against her chest like it was a shield. Her husband was with her, but he was standing by the door, looking at his phone. He did not even pull a chair for her. I noticed that immediately. Mira sat down and placed the folder on my desk. She did not say hello. She did not tell me her name. She just opened it and pointed to the report on top. I picked it up and saw the letterhead of a well-known hospital in the city. The diagnosis was written in bold letters. Severe fetal hydrocephalus. Poor prognosis. Strongly recommended termination of pregnancy. I looked up at Mira, and she was staring at the wall behind me. Her eyes were completely dry. Her hands were folded on her lap, perfectly still. Her husband finally spoke from the door. He said, "The doctors told us the baby has no brain. We are here for a second opinion, but we have already decided." Mira did not nod. She did not argue. She just sat there in that terrible silence. And in that moment, I knew she had not decided anything. She was just too broken to speak. I pulled my chair closer to her and asked the only question that mattered. "What does your heart say?" She looked at me for the first time. Her lips trembled, but no sound came out. I waited. The room was so quiet that I could hear the clock ticking on my wall. Then slowly, tears started rolling down her cheeks. Still, she did not make a sound. She just placed her hand on her belly and held it there. That was when I knew I was not looking at a woman who wanted to terminate. I was looking at a mother who had been told to kill her child, and she did not know how to carry that weight alone. I opened the folder fully and started reading every page carefully. The reports were from one of the best fetal medicine centers in the country. They had done everything correctly. The ultrasound images showed a baby with a significantly enlarged head. The brain ventricles, which are normally small spaces filled with fluid, were massively dilated. The doctors had measured the fluid at over 15 millimeters, when the normal range is under 10. But what worried me more was a note at the bottom of the report. It said that the cerebral mantle, the actual brain tissue, was compressed to less than 5 millimeters. That is dangerously thin. I looked at the images again. The baby's head looked like a balloon filled mostly with water. The brain was pushed against the skull like a tiny sponge at the bottom of a swimming pool. I have seen hydrocephalus before. Many times. But this was severe. I understood why the other doctors had been so direct with their recommendation. Medically speaking, they were not wrong. Mira was still watching me. Her husband had finally moved from the door and was standing near the window. He said, "The doctors told us that even if the baby survives, she will never be normal. She will never walk or talk or recognize us. They said we are young. We can try again." His voice was calm, logical, like he was discussing a business decision. He looked at Mira and added, "She is not accepting it." I kept my eyes on Mira. Her hand had not left her belly. I asked her gently, "When did you last feel the baby move?" Her voice came out like a whisper. "This morning. She kicked me when I was brushing my teeth." She said the word she, not the baby. Not it. That small word told me everything. Mira already knew her daughter. She had already named her in her heart. She had already imagined a life with her. And now, the entire medical establishment was telling her that imagining that life was a mistake. Her husband sighed loudly and walked to the door again. "Tell her, doctor. Tell her that keeping this baby is not fair to anyone. Not to us. Not to the child." I looked at the report one more time. Then I looked at Mira's face. And I realized that fairness had nothing to do with what was sitting in that room. She was not asking me for statistics. She was asking me if it was okay to love someone everyone else had already buried. I told Mira that I wanted to do my own ultrasound. Not because I doubted the other doctors, but because I have learned over the years that every baby tells their own story, and sometimes machines miss the small details. Mira nodded and lay down on the examination table. Her husband stayed in the waiting room. He said he had seen enough pictures already. I applied the gel on her belly and placed the probe gently. The image appeared on the screen. It was exactly as the reports had described. The baby's head looked abnormally large, and the dark spaces inside the skull were undeniable. The fluid was everywhere. The brain tissue was pushed to one side, thin and fragile looking. I measured the ventricles myself. 17 millimeters. Worse than the previous report. But then I turned on the color Doppler to check the blood flow. That is when I noticed something the other doctors had not mentioned. The blood vessels in the baby's brain were still active. They were still carrying oxygen. The tiny heart was beating strong, 145 beats per minute, perfectly within normal range. I watched the screen for a long time, and then I saw something that stopped my breath. Every few seconds, the baby would move her hand. It was a small movement, barely visible, but every time she moved it, she brought it toward the front of the womb, toward the spot where the ultrasound probe was touching Mira's belly. It looked like she was reaching for the sound, reaching for the warmth, reaching for her mother. I pointed at the screen and said, "Mira, look." She turned her head and stared. For a moment, I do not think she understood what she was seeing. But then the baby moved again, and Mira gasped. Her hand flew to her mouth. Tears started falling freely now, not silent tears but the kind that come with sound, with pain, with a love so fierce it hurts. She whispered, "She knows I am here." I did not correct her. I did not say it was just a reflex, because I have seen too many things in my career to call a baby reaching for her mother just a reflex. I kept the probe still, and we both watched that tiny hand move again and again. Mira started crying openly, but for the first time that day, she was not crying because she was broken. She was crying because she had just seen her daughter fight for her. After the ultrasound, Mira walked back to the waiting room with red eyes and a different kind of expression on her face. She was not smiling, but she was not empty anymore either. She went straight to her husband and said, "I saw her move. She is fighting." He looked at me over her shoulder, and I could see the frustration building in his eyes. He did not say anything in front of the other patients. He just took Mira's arm and led her outside. I watched them from my window. They stood near the parking lot, and even though I could not hear the words, I could see everything. His hands were moving sharply. His jaw was tight. Mira stood with her arms wrapped around her belly, shrinking smaller and smaller with every sentence he spoke. Then she shook her head, and he turned away from her. He got into the car and drove off. He left her standing there alone in the parking lot. She came back inside after 20 minutes. She sat in the same chair and said, "He thinks I am choosing a dead baby over our marriage." Her voice was steady, but her hands were shaking. I poured her a glass of water and sat beside her. She told me that her husband had already told his parents about the diagnosis. They had all agreed that termination was the only reasonable choice. They had even scheduled an appointment at a clinic for the following week. Mira had canceled it without telling anyone. That was why she had come to me. Not for a second opinion. For a lifeline. She said, "He told me that if I keep this baby, I will raise her alone. He said he cannot watch his child suffer. He said it is mercy to let her go." Mira looked down at her belly and placed both hands on it. "But doctor, how is it mercy to kill someone who is moving inside me? How is it love to give up before she has even had a chance?" I did not have an answer for her. I have delivered babies with severe abnormalities before. Some of them lived for a few hours. Some of them lived for a few days. Some of them surprised everyone and lived for years. But I have also seen mothers destroyed by the weight of watching their children suffer. I could not tell Mira that she was wrong, and I could not tell her that she was right. All I could do was say, "Then let us take this 1 week at a time. Come back every 7 days. We will watch her together." She nodded and stood up. At the door, she turned back and said, "I named her Anya. It means grace. Because even if she never walks, she has already taught me what grace looks like. Mira came back the next week alone. And the week after that. And the week after that. Each time, she would walk into my clinic with the same quiet determination, place her bag on the floor, and lie down on the examination table without me having to ask. Her husband never came with her again. She told me he had moved into his parents' house. He called her once a week to ask if she had changed her mind. She never did. The scans showed the same terrible pictures every time. The fluid in Anya's brain was not decreasing. If anything, it was slowly increasing. The head circumference was growing faster than normal. I measured the cerebral mantle again and again, hoping for a miracle that the numbers would not give me. But there was something else I noticed during those weekly visits. Mira had started talking to Anya during the scans. Not in her head, but out loud, right there in the room. She would say things like, "See that light, Anya? That is the doctor looking at you." Or, "You kicked me this morning. That was a strong one." Or, "I love you. I love you. I love you." She said it so many times that the words became a rhythm, a heartbeat of their own. One afternoon, she asked me a question that I had been dreading. "Doctor, when she is born, will she feel pain?" I put my hand on hers and told her the truth. We did not know. The brain was so compressed that we could not predict what functions would be present. She might feel pain. She might not. She might be aware. She might be in a permanent state of sleep. The honest answer was that no one could say for sure. Mira was quiet for a long time. Then she said, "Then I will feel enough pain for both of us." She smiled a little, the first smile I had seen from her since she walked into my clinic. It was a broken smile, but it was real. I made a decision that day. I called the head of neonatology and the pediatric neurosurgery team. I told them about Mira. I told them about Anya. I said, "When this baby is born, I want every possible resource available. No one is giving up on her before she takes her first breath." There was silence on the other end of the line. Then my colleague said, "You know the odds, right?" I said, "I know. But the mother has already chosen the impossible path. The least we can do is walk it with her." The 28th week arrived like a storm I could feel coming but could not stop. Mira walked into my clinic on that Tuesday morning, and I noticed something was different before she even sat down. She was holding her belly differently, higher up, almost like she was trying to hold the weight of something heavy. Her face was pale, and there were dark circles under her eyes that had not been there the week before. She lay down for the scan, and I placed the probe on her belly. My heart sank immediately. The fluid in Anya's brain had doubled. Not increased by a small percentage, but doubled. The ventricles were now measuring over 30 millimeters. The head circumference had jumped off the growth chart entirely. But what scared me more was the cerebral mantle. The thin layer of brain tissue that had been 5 millimeters was now compressed to barely 2 millimeters. I kept my face neutral, but Mira was watching me. She had learned to read my expressions over the past 6 weeks. She said, "It is worse, isn't it?" I did not lie to her. I turned the screen so she could see and showed her the measurements. I explained that the fluid was putting pressure on the remaining brain tissue, and if this continued, there might be nothing left to salvage by the time Anya was born. Mira did not cry. She sat up, pulled her shirt down, and asked the question I had been dreading. "Did I make a mistake, doctor? Am I being selfish? Am I keeping her alive just to watch her suffer?" Her voice cracked on the word suffer. She looked at me with eyes that were begging for someone to tell her what to do, because she had been carrying this weight entirely alone for too long. I sat beside her and held her hands. They were cold and trembling. I told her the truth. I do not know if this will have a happy ending. I have never been able to promise that to any mother. But I can tell you this. You are not selfish. Selfish people do not sit in a doctor's office week after week, knowing the news will be bad, and still show up. Selfish people do not name their daughters Grace and mean it. She leaned her head on my shoulder and whispered, "I am so tired, doctor. I am so tired of being brave." We sat like that for a long time, and in that silence, I felt Anya kick against my arm, a small defiant kick, as if she was reminding both of us that she was still there. I admitted Mira to the hospital that same day. Her blood pressure had started climbing, and I was worried about preeclampsia on top of everything else. She needed to be monitored around the clock. She did not argue. I think a part of her was relieved to be somewhere that felt safe, surrounded by people who knew her name and her baby's name. The first few nights were hard. The nursing staff told me that Mira barely slept. She would lie in her bed with her hand on her belly, staring at the ceiling, counting kicks. Every time the monitors beeped, she would sit up straight, afraid that the sound meant something was wrong. She had stopped calling her husband. He had stopped calling her too. On the fourth night, something happened that I still struggle to explain. It was around 2 in the morning. Mira was sitting in the corridor outside her room, because she said the walls felt too close. She was crying quietly, the kind of crying that is more about exhaustion than sadness. An elderly cleaning lady was mopping the floors nearby. Her name was Saroj, and she had worked in that hospital for over 20 years. She had seen everything: births, deaths, miracles, tragedies. Saroj stopped mopping and looked at Mira. She did not ask any questions. She did not offer any advice. She simply put her mop aside, sat down on the floor next to Mira's chair, and took Mira's hands in hers. Then she closed her eyes and started to pray. Not out loud, but silently, moving her lips. She placed one of her rough, worn hands on Mira's belly and kept it there. Mira told me the next morning that she had never felt anything like it. She said Saroj's hand felt warm, impossibly warm, like heat was coming through her skin and going straight to Anya. They sat like that for 20 minutes. No words. Just an old cleaning lady praying over a stranger's unborn child in a hospital corridor at 2 in the morning. When Saroj finally stood up, she looked at Mira and said only one thing. The child is not alone. You are not alone. There are hands holding you that you cannot see. The next morning, I did a routine ultrasound before starting my rounds. I measured the fluid levels twice. Then a third time. They had stopped increasing. Not decreased, but stopped. Completely. I stared at the screen, confused, searching for an explanation that my medical training could give me. I did not find one. At 34 weeks and 2 days, my phone rang at 3 in the morning. It was the labor ward. Mira had gone into spontaneous labor. Her water had broken while she was trying to sleep, and the contractions had started fast, coming every 3 minutes. I threw on my coat and drove to the hospital in the rain, running every possible scenario through my head. Anya was still too small. The brain fluid was still dangerously high. And now, labor was forcing them into a corner with no time left to prepare. I walked into the delivery room to find chaos wrapped in silence. The NICU team was already there, 6 of them surrounding a warmer, checking equipment, whispering to each other. The pediatric neurosurgeon had been called in. He stood at the corner with his arms crossed, waiting. Mira was on the bed, breathing hard through each contraction, her face wet with sweat and tears. She looked at me the moment I walked in, and I saw pure terror in her eyes. I checked her progress. She was already 6 centimeters dilated. There was no stopping this. The baby was coming. Then the monitors changed. The fetal heart rate, which had been steady at 140 beats per minute, started dropping with every contraction. 130, 120, 110, 90. Each time Mira's uterus tightened, Anya's heart slowed down. The pattern was clear. The contractions were compressing the baby's head, and the fluid-filled brain was struggling to handle the pressure. The senior obstetrician on call pulled me aside. She said, "If we wait for her to deliver naturally, the baby might not survive the stress of labor. We need to consider an emergency cesarean section now." But there was another problem. Anya's head was so enlarged that a C-section would require a larger incision than usual, and even then, delivering the head safely would be a challenge. There was a real risk of brain damage during the delivery itself. I walked back to Mira and held her hand. I explained everything. The dropping heart rate, the pressure of contractions, the risk of waiting, the risk of surgery. I said. Mira, I need you to make a decision. And I need you to make it now. Another contraction hit. Mira screamed. When it passed, she looked at me with eyes that had already made peace with every possible ending. She said, "Get her out. However you have to. Just get her out alive." I nodded and turned to the team. The room exploded into motion. The operating room was freezing cold, the way it always is before an emergency delivery. Mira was given the spinal anesthesia quickly, and within minutes, she was numb from her chest down. I stood beside her head, holding her hand, while the surgical team worked behind the blue drape. She kept asking me the same question over and over. Is she out yet? Is she crying? Do you hear her? I kept telling her to wait, just a little longer, just a few more seconds. The surgeon made the incision, and I heard her gasp quietly. She later told me that Anya's head was even larger than the scans had predicted. The uterine incision had to be extended twice to create enough space. The team worked carefully, gently, because one wrong move could damage the baby's fragile neck or cause bleeding in the brain. Time moved strangely in that room. Seconds felt like hours. Then the surgeon said, "Head is out." A pause. "Shoulders are out." Another pause. And then the entire baby was lifted from the womb. She was blue. Completely blue. Her little body was limp, her arms hanging heavy, her face still. The umbilical cord was wrapped loosely around her neck, and the fluid in her head made her look almost translucent under the bright lights. The NICU team moved instantly. They took Anya to the warmer and began resuscitation. One nurse started gentle suction to clear her airways. Another placed a tiny mask over her nose and mouth to breathe for her. The neonatologist listened for a heartbeat, then started chest compressions. The room was silent except for the beeping of monitors and the soft commands of the medical team. I looked at Mira. She was staring at the ceiling, tears streaming down the sides of her face, her lips moving in what looked like a prayer. She was not asking me any questions anymore. She had stopped asking. She was just waiting, the same way she had waited for 22 weeks, the same way she had waited through every bad scan and every lonely night. 30 seconds passed. 40 seconds. 50 seconds. The NICU team kept working, their faces focused, their hands steady. I started counting in my head, preparing myself for the worst. And then, just as I reached 60 seconds, a sound came from the warmer. It was small, weak, barely audible over the machines. But it was a cry. It was not the loud, angry cry of a healthy newborn. It was thin and fragile, like the mew of a small kitten. But it was a cry. It meant she was breathing. It meant her heart was beating on its own. It meant she was alive. The neonatologist looked up at me and nodded once. I turned to Mira and said, "She is crying. She is here. She is alive." Mira let out a sound that was not a cry and not a laugh, but something in between, something primal and raw. The nurses placed Anya on Mira's chest for just a moment, just long enough for a mother to meet her daughter. Anya's tiny hand curled around Mira's finger. Mira kissed her forehead and whispered, "I knew you would fight. I knew it. I never stopped believing." Then the team whisked Anya away to the NICU. But that one moment, that one cry, had already changed everything. The first time I saw Anya in the NICU, she looked impossibly small surrounded by all that machinery. Tubes ran from her tiny body to ventilators and monitors. A white bandage covered the spot on her head where the neurosurgeon had placed the shunt just 2 days after birth. That small device was now draining the fluid from her brain, giving the compressed tissue room to grow. But no one knew if that tissue would ever function the way it was supposed to. Mira spent every single day in that NICU. She arrived at 6 in the morning, before the morning rush, and she left at 10 at night, after the final feeding. Sometimes I would walk past the glass windows and see her sitting in the hard plastic chair next to the incubator, reading aloud from a small book of bedtime stories. She read the same 3 books over and over, because those were the only ones she had brought from home. Her voice was always soft, always steady, even when her eyes were red from exhaustion. The nurses told me that Mira never missed a single diaper change. She learned how to feed Anya through the tube that went from her nose to her stomach. She learned how to check the shunt site for signs of infection. She learned how to interpret the monitors, which beeps were normal and which ones meant trouble. She became, in every practical sense, a nurse herself. The second week was the hardest. Anya developed an infection at the shunt site. Her temperature spiked to 103 degrees. She stopped moving. She stopped crying. Mira sat by the incubator for 48 hours straight, refusing to leave even to eat. I brought her food myself and watched her eat with one hand while holding Anya's tiny foot with the other. She said to me, "I carried her for 34 weeks. I am not going to abandon her now." The antibiotics worked slowly. By the 5th day, the fever broke. Anya opened her eyes for the first time. They were dark and confused, the way all newborn eyes are, but they were open. Mira leaned over the incubator and said, "Hello, my Grace. I have been waiting to see those eyes." And for just a moment, Anya's gaze seemed to fix on her mother's face. The doctors remained cautious. They warned Mira that the brain damage was already done. They said Anya would likely have significant developmental delays. She might never walk. She might never talk. She might need round-the-clock care for her entire life. Mira listened to all of it without crying. When they finished, she said, "Then I will be her legs. I will be her voice. I will be her nurse." That is what mothers do. The 3rd week brought the first small miracle. Anya started breathing on her own. The ventilator was removed, and for the first time since birth, her chest rose and fell without a machine helping her. Mira held her properly for the first time, skin to skin, pressing her daughter against her heart. Anya made a small sound, not a cry, but a sigh, like she was finally comfortable. The 4th week, Anya took a bottle for the first time. It was only 5 milliliters, barely a teaspoon, but she swallowed. She did not choke. She swallowed. Mira called me into the room, crying and laughing at the same time, holding up the empty bottle, like it was a trophy. I looked at that tiny amount of milk and thought about all the mothers I had seen who took home healthy, perfect babies and still found reasons to complain. And then I looked at Mira, celebrating a teaspoon, and I understood what real gratitude looked like. By the 6th week, Anya had gained weight. She was still small, still fragile, still connected to monitors and tubes. But she was alive. And she was fighting. The doctors started talking about discharge. They trained Mira on how to care for the shunt at home. They showed her what signs of infection to watch for. They gave her a thick binder full of instructions and emergency numbers. On the day of discharge, Mira walked out of the hospital carrying Anya in her arms. No wheelchair. No nurses following behind. Just a mother and her daughter, walking toward the exit together. I stood at the window and watched them get into a taxi. Mira had told me that her husband had called the night before. He wanted to see the baby. He wanted to come home. She had told him she would think about it. The taxi drove away, and I said a small prayer for both of them. The journey was not over. In many ways, it was just beginning. But they had made it this far. And sometimes that is enough. I saw Mira again 1 year later. She walked into my clinic on a bright Wednesday morning, and this time, she was not alone. She was pushing a small white stroller, and inside that stroller sat Anya. I almost did not recognize her. The baby I had last seen as a fragile newborn, pale and tiny, was now a chubby-cheeked girl with dark curly hair and wide brown eyes. She was wearing a pink dress with little flowers on it, and she was awake, looking around the room with curiosity. Mira looked different too. The exhaustion that had lived in her eyes for so many months was gone. She was smiling, a real smile that reached her eyes. She lifted Anya out of the stroller and placed her on the examination table. I did a quick assessment. Anya was still small for her age, but she was growing. Her head was still larger than normal, even with the shunt, but the fluid levels were stable. The neurosurgeon's report showed that the brain tissue had expanded slightly, filling some of the space that had once been occupied by fluid. But what touched me more than the medical numbers was what happened next. I called Anya's name softly, and she turned her head toward the sound. Slowly, very slowly, she lifted her right hand and reached toward my face. Her movements were jerky and uncoordinated. She could not hold her head up completely on her own. She could not sit without support. But she reached for me. She knew someone was there. Mira said. She recognizes faces now. She smiles when I sing to her. She does not say words yet, but she makes sounds. Different sounds for when she is happy and when she is hungry. Her voice was proud, the way any mother's voice is proud when talking about their child. And I realized that Mira had stopped measuring her daughter against the world's definition of normal. She had created her own definition. I asked about her husband. Mira told me that he had come back. He had walked into their apartment 3 days after she brought Anya home, and Moments like these remind me why I chose this profession. Not for the successful deliveries or the healthy babies, but for the mothers like Mira who teach me what love actually means. Love is not celebrating when things go right. Love is staying when everything goes wrong. Love is sitting in a NICU for 6 weeks. Love is celebrating a teaspoon of milk. If you are carrying a child right now, especially a child that others have told you to give up on, remember this. You do not need to have a perfect baby to be a perfect mother. You just need to show up. Again and again and again. That is the only miracle that matters.